Hi, I'm Nick the Nurse. Today we're going to be talking about the nursing diagnoses that might relate to a patient who has an aortic aneurysm. So try to get in the mind of a patient who has an aortic aneurysm. What might you be feeling if you were the patient? And I think, again, I don't want to go too far off topic, but when answering questions in nursing school exams or on the NCLEX, try to get inside the mind of the patient or even inside of the mind of the nurse. What might the patient be feeling? What might the nurse be seeing? These are all things that can kind of lead you to think about critically about what the patient needs, what they're experiencing, and what we can do in developing care plans and nursing diagnoses for these patients. One big thing that a patient who has an aortic aneurysm might be thinking is fear. Fear of what? Fear of not being able to live their life fully, fear of death. They have fear. That's a nursing diagnosis that pertains to a patient who has aortic aneurysm. They have a fear with relation to their well-being. Why? Because a patient who has an aortic aneurysm faces a real risk of what? Of death. Why? Because if an unruptured aneurysm becomes ruptured, unless there's a rapid surgical intervention, the likelihood that the patient might die from a ruptured aneurysm is remarkably high. Another nursing diagnosis that you might look for in a patient who has an aortic aneurysm is acute pain. Remember, I told you when we talked about the signs and symptoms of a patient, particularly of one who has a ruptured aortic aneurysm, it's going to be a very painful tearing feeling. Well, that's acute pain, and so we need to make sure that in our nursing diagnoses, when we're writing our care plans and addressing our patient's needs, that we address the issue of acute pain. Additionally, they might have anxiety. Now, this kind of relates to fear, but they might be anxious. What's going to happen? I've got this pulsating mass in my abdomen. This isn't normal. I've led a very healthy life. I just might not have controlled my blood pressure or taken my blood pressure medication, but I've led a healthy life, and I feel anxious. I don't know what's coming. I'm anxious about the surgery. If the doctor is going to take a non-conservative approach toward addressing the aortic aneurysm, this can lead to a lot of anxiety in the patient. So we want to make sure that we keep anxiety at the forefront of our nursing diagnoses and care plans as well. So these are three nursing diagnoses that apply very much to a patient who has an aortic aneurysm. Again, my name is Nick the Nurse. I thank you for watching my video, and we'll see you next time.